that we should be more closely following the commission format that the city uses, and allowing members of the public to join us virtually if they register in advance, so that they can speak to us over Zoom. And we're gonna have to get used to this a little bit, but it is very easy for the public to watch us on Facebook, YouTube, or on the city website. And it looks like we've got quite a few folks here now, so maybe if we could just briefly go down the list and introduce everybody, that would be great, since I know that we do have Lieutenant Jameson joining us from the police department, and he's new to our group. So you all know me, I'm Tegan McLean. I'm the Community Engagement and Inclusion Administrator. And Anthony, you're next on my list, so I'll let you introduce yourself.
Sure, my name is Anthony Teixeira, and I'm the Program Coordinator for the Youth and Teens of the City of Milpitas.
And John, you're next on my list.
Yes, hi everybody. John Macon, I'm a Recreation Services Supervisor here with Milpitas.
And Councilmember Nunez, would you like to say a few words?
Yes, hello.
Man of few words.
Yes, yeah, man of few words.
Brian, you want to introduce yourself?
Hi, my name is Brian Chow. I'm the CASA specialist with Child Advocates of Silicon Valley. Thank you.
Thank you. And John is really Jay to the rest of us. So Jay, you want to introduce yourself?
Yeah, hi everyone. I'm Jay. My Zoom title says John though, but I'm Jay. I'm a suicide prevention coordinator with the County Behavioral Health Services Department.
And Lisa?
Hi everyone, I'm Lisa Miller. I'm with Counseling and Support Services for Youth. I'm one of the program managers. We put school-based mental health services into schools all across Santa Clara County.
Nick?
So, hi John, hi Tegan. Nice to see you all again.
Hi, nice to see you.
So Nicholas Aguilar, I'm also with Child Advocates of Silicon Valley. I'm one of the CASA specialists, and I supervise the LGBTQ program.
Thank you. And Marcia, I didn't ask you yet to introduce yourself, I don't think.
No, hi, I'm Marcia Lee, longtime Milpitas resident, and I actually am also the chair of CASA, so I'm happy to see Lisa here with us. I know she's created quite a bit of efficiency for us, and I really appreciate her contributions.
Great. And Pastor Mize?
Yeah, Robert Mize, a pastor at Cathedral of Faith here in Milpitas, and really happy to be part of this group.
And Lieutenant Jameson?
I'm sorry, was that for me, Tegan?
Oh, I wanted to allow you to introduce yourself to the group. Maybe tell us how long you've been with the police force.
Yep, so my name's Tyler Jameson. I'm a lieutenant with the Milpitas Police Department. Been with the police force for about 11 years, 15 years total in law enforcement. I'm assigned to patrol, and I've also been a member of our peer support team since its inception over 10 years ago. So looking forward to being a part of the group.
Thank you. We're glad to have you join us. And Tom, you want to introduce yourself? Maybe while Tom's getting set. Dawn, I think you jumped in and I didn't have a chance to have you introduce yourself.
Great. How are we just name and
where you're from?
Oh.
Yeah.
So my name is Dawn Brown, and I'm with NAMI, Santa Clara County, and I live in Milpitas.
Tom, are you able to get your microphone going? Doesn't look like it. Okay, well, we'll move along. And Tom, when you get your mic going, just feel free to say hi. So as part of our new format change, the public forum, those who are interested are invited to address the task force on any subject that's not listed on the agenda via the public meeting comments. Actually, this information is a little bit wrong because now they can join us live using the link if they've registered in advance. And rather than me having to read their comments, they can say their comments themselves. There is no response required of us if the members of the public address us. However, the task force members may wish to add the future item to the agenda. And like all city meetings, this public meeting will be led with professionalism, respect, and civility, so no profanity or vulgar language is allowed. We usually start kind of toward the top of our month, an update from Santa Clara County Behavioral Health Services Department and the suicide prevention group there. So Jay, you want to share some stuff with us that you guys have been doing? Lots of exciting things.
Yeah, we've got a lot going on. So the first thing to update you all on is we have our older adult campaign. So try to update the group every meeting about that. So this is a campaign targeting suicide prevention campaign targeting the Vietnamese, Chinese, Spanish, and English speaking older adults in our county to improve knowledge and attitudes toward suicide and promote help-seeking behavior. So this campaign includes radio ads in 4 languages, all 4 that I just mentioned. So Vietnamese, Chinese, Mandarin, Spanish, and English. And we also have a flyer in Vietnamese, a video ad in Vietnamese airing on television and online, and an online video ad in English that was sort of a condensed version of an older campaign video, a previous campaign video, I should say, from a successful campaign that our program had done. All of these were encouraging folks to call either the National Lifeline or visit one of the campaign web pages that we created specifically for the campaign in their language. So each web page has information on knowing warning signs, how to recognize them, what to do if you do recognize them, and then resources to connect the person that you see them into, whether it's yourself, a loved one, stranger, family, friend. So that's just some quick background. So we launched on September 3rd, so a little bit over a month now. It's still on air, at least the Vietnamese parts are still on television and radio. So some updates are, since the launch, the web pages have received around north of 15,000 page views.
That's awesome.
Yeah, the Vietnamese and English are being viewed really heavily because of we put some online programmatic buying and things like that. So we're particularly targeting those communities. And our online ads on our behavioral health services YouTube page in English and Vietnamese have both accrued over 25,000 views each. So in total, more than 50,000 now. And that number is still actually growing pretty much every day. I updated recently, and Vic heard the smaller numbers, so we're still growing a little bit, Vic. Tracking the radio and the TV reach as well right now, and we're going to continue to track campaign reach to help us evaluate the campaign. So we're going to monitor the National Lifeline, compare the call numbers from the campaign time to previous months, but also look back at the same time span last year and compare the call numbers to see, just see if there was any kind of fluctuation one way or the other. And we've also distributed digital surveys in the community as well as paper surveys at clinics to help us evaluate the campaign. We're working with local Vietnamese community members to help with that survey participation in their community organizations, temples, churches, and we're starting to see some more online participation, which is awesome. And we'll see about the paper, that remains to be seen, but those are going to be collected in the upcoming weeks. And then finally, we just wrapped up the Mandarin and Spanish portions of this last week. And we're still going for about another 2 weeks. So we're excited to see the reach so far that we've got, and hopefully we'll see even more. That is our campaign update for our sort of our active campaign right now. The next thing, Tegan, is it all right if I just sort of
Yeah, just please go ahead.
Great. So the next thing is, last month, our program also provided a community opportunity, so a free virtual opportunity to watch the documentary Angst. If you haven't seen it, it's excellent. And each person could get a link and watch the movie, the documentary, and then they could jump on a Zoom link and watch a panel discussion from local mental health experts discussing some of the film's topics, and also to sort of branch out as needed if folks started asking questions, things like that. The screenings and panel discussions were offered in English, Spanish, Chinese, and Vietnamese. And they were created, or the documentary itself is to help folks learn the symptoms of anxiety and encourage them to reach out for help. So the documentary from our effort from the screenings was viewed by 434 residents in the county, and the follow-up panel discussions were joined by 102 county residents. And I was actually lucky enough to monitor the Vietnamese one, and it was fantastic. And we have uploaded we're going to upload the Vietnamese recording of that to hopefully our YouTube page. And not sure if we can promote that through Facebook or something like that as well. But that's our update for the Angst screenings. They were very successful. It was great.
Jay, were you able to tell if you had any from Milpitas?
So I don't think we would be able to tell that specifically.
Okay.
But my guess is, I was just going to thank you all for promoting that, because that was I generally hope is one of my first connecting, whenever I get an email or something that's, a position posting, I usually send it right over to Hope. So I would like to thank you all for promoting that. I know a bunch of you did, and, reaching that many folks is great. And even in the Vietnamese panel that I monitored, we did have a lot of discussion, or a lot of participants, but that particular participant found this to be invaluable. And we're hoping to sort of like see if we can offer similar things to this again in the future, because this was so successful and we really enjoyed doing it. So thank you. The next thing is the TikTok video statement. And so that had come up at our previous meeting last month. And so just to give a little more background on that, so there was a video that was circulating social media depicting a suicide death. It was on different platforms, particularly TikTok. And our communications work group had a discussion on what we felt is our responsibility as a county body to address the video. And I think Vic's still in the meeting. Vic was big in steering that conversation for us. And the work group determined that we want to communicate how detrimental that kind of video is, that kind of content is to others. So we drafted a statement that we are hoping to distribute to local organizations, advising that they address that and that kind of content that circulates online, emphasizing particularly safe online communications as it pertains to suicide. We're looking to include the County Office of Education to ensure that parents and staff are aware of this, and we want to encourage them to use specific resources. A big one is ChatSafe from Origin. If you've heard of it, ChatSafe is an excellent online communication resource for both, teens as well as parents communicating with their teens. And we're looking to pretty much explore connections with organizations involved in safe messaging to see how much we can actually try to affect some change and get folks to push these resources out and really start to monitor for this kind of content being there, because it's impacting our community locally. This kind of thing can trigger, I don't like the word trigger, but it can cause suicide contagion in certain cases, and we really want to avoid that and try to steer this conversation in a positive direction. So we just sort of passed our statement through the communications work group members, and it's hopefully going to be in our newsletter, which should be going out this week, maybe in the next day or two. And as soon as I have that, I know, Tegan, that this committee had requested that we sort of fill them in on that, and I will absolutely provide you with the statement if you all are interested in making a similar statement or just keeping in step with the county on that.
Great.
Yeah. And So I'll keep you updated on that, promise. And then the fourth thing is, so we do have our current campaign that is sort of wrapping up right now. We are actually looking at, we're in the really early stages of developing a radio campaign targeting English and Spanish speaking middle-aged men to promote help seeking. And this is going to be sort of an extension from a previous radio campaign we did in 2018. And with some other like kind of samplings of other radio campaigns from the past. So we're workshopping that right now. We have focus groups actually coming up on that. So it's going to be English, Spanish, but that's very early stages. Just wanted to sort of see. That's everything.
Great, thank you. And our next item is some town halls that we're working on mental health needs and resources. And John, you're heading those up, so you want to share with us
Yes.
what the progress is?
Sure. Hi, everybody. Yeah, at the end of last meeting, we highlighted our desire to, in Milpitas, to offer some town halls similar to, or dovetailing, I guess, off Jay and Mago's work at the county with their town halls, specifically during this shelter in place or during COVID. And we've identified a tentative theme of managing stress during difficult times. And then from that,
Oh, John, you've disappeared.
out. Can you hear me now?
Yeah,
Okay, I'm sorry.
we lost you after managing stress in difficult times.
Oh, you've lost me a lot. Yeah, just Tegan, Renee, and I talked about hosting some town halls 2 or 3 months, and we're talking possibly October, November, December, but we've decided to move that out to mid-November, December, and January. And what we're looking at is a theme of managing stress during difficult times, and initially mid-November, having a youth and adult focused town hall. And what we'd like to be able to do is initially, and Jay and Mago has been wonderful to suggest some potential facilitators. And working with Anthony, looks like we have a group of teens that could be on the panel, but we are looking for a facilitator for that youth and adult. So I'd like to open it up to our task force first. If you have interest in facilitating or co-facilitating that, you could express your interest now or let me know offline. But we're looking at a mid-November date, and that'll kickstart our town halls, and that'll be a youth and adult focus. And then following that, we'll do first week of December will be more of a cultural community. So that will be English, Mandarin, and Vietnamese. And we have some facilitators targeted through, again, through Mago and Jay to help support that. That'll be probably the first part of December. And then mid-December, similar to what we did last year with the season of self-care, we want to have a session, holiday season support group level town hall. So we're looking at mid-November through December to kickstart the town halls, and hopefully there'll be
John, I think we lost you again, but hopefully they'll be great and we will continue with them.
Can I ask a question real quick? Actually?
Yeah, please.
Okay, John, I think you're back. John, did you say, so I got everything from November to December. Did you say that you do have something scheduled for January? You're going to see how November and December go, and then
we're certainly going to offer that, but we wanted to get the first couple off the ground, especially expanding into, we talked about the older adults, the seniors, the different languages, but we thought we'd kind of fine tune the first couple, but certainly into the new year, we want to continue.
Okay, great. Thank you.
John, this is Lisa from Cassie. I'd love to help facilitate that one with the youth adult focus.
Oh, wonderful, Lisa. Thank you. Great. We'll talk more about that.
Sounds good. You know how to get a hold of me.
Yes, thank you.
Thank you for volunteering, Lisa. Next on our agenda is our work group updates. And I know that the diversity group, we haven't met, but we've been off doing our our different contacts. Don, Jay, and I and Tom are part of that group. I did speak to the Vets Commission last week and asked for their assistance in connecting us with somebody who would be a good representative to Milpitas Vets. And I know they're working on it. I've exchanged emails with one of the commission members. We also sent out information in the senior newsletter inviting the senior community to suggest someone. And I know Tom was in contact with one of the communities, senior communities here in town. Tom, did you want to share anything? I see your microphone's working now.
Sure. I did make contact with the DeVries project that's over across the way from the library. And it took a while, but I finally got in touch with somebody, and the individual did indicate that she wanted to participate and was happy to participate so that she could get information out to the residents. However, she did indicate that potentially, I'm assuming that you did send her an invitation.
I believe we sent her an invitation for this meeting, yes, but didn't have a response. So we'll try again next month.
Yeah, she did indicate that she might have a conflict for this meeting. But if you could send her any minutes and let her know what the schedule is for our meetings, that might be helpful for her so she could put that on her calendar. I also
Perfect.
spoke to Marcia, is it Paul Gonzalez? Marcia, you're muted.
I know. You spoke to Paul Escobar.
Oh, Escobar. Yeah, I spoke to Paul Escobar. Unfortunately, at the time that I managed to reach him, he was in North Carolina. But he indicated that he would try to help out and find a point of contact for the LGBT community. So I meant to contact him again, but I didn't want to necessarily unduly bother him. But I will, before the next meeting, call him again and see if, because he does have some individuals, well, he's tied into that community. He knows people on the Rainbow Chamber of Commerce. And so I think we will ultimately get a representative there also. So it looks like both of those that I was committing to should bear fruit.
Great. Don, Jay, do you either have something you want to share? I know, Don, you were working on some leads for us.
I was. So I reached out to Cambria Bruschke, who leads the National Suicide Prevention Learning Collaborative, to see if she could recommend somebody from Santa Clara, Kaiser, to kind of join the team, and if she might want to join in and just share some of the amazing work that she's done over the months, really over the years, of bringing people together around this topic around the nation. There's some great work that's being done around the country. So I just invited her. I did reach out to Rochelle Woods, Dr. Woods, who's the chief of psychiatry and the director of the memory clinic at Kaiser Santa Clara. I haven't heard back, but I did hear back from Hira, who directs and supports Dr. Renaya Awad at the Khalil Center. And that is a Muslim organization. And she said they're very excited. So she's trying to identify someone who she thought locally would be able to, who's in this area, who would be interested in and available, because she said they are interested, but available to be able to join the task force. So she thought it would be great. She said she would do it if she wasn't, kind of strapped. She's also a clinician.
Great, thank you. Sounds like some good leads. Jay, I don't know that you had any that you were working on at the moment, so.
I did not, but
did,
obviously.
You want to share them?
Okay. I'm more than happy to obviously try. I have some decent county Vietnamese older adult connections. So if we want to explore that, just let me know and I'll make some calls.
I think that'd be great. Our next work group is postvention, and that's Dawn, Marcia, was Captain Hernandez, but now Lieutenant Jameson, Renee, myself, Pastor Mize, Vice Mayor Nunez, and Nicole Stewart. And we also didn't meet, but I know staff is working on kind of a rough draft that we'll hope to share with you at the next meeting of a handout that we want to make available to PD so that the officers will have something available should they go on a call where there's a death or an attempt. And we're also, wanting to make it geared toward grieving families, giving them resources. So I'll be connecting offline with Lieutenant Jameson and the rest of you to share that so that maybe we can present that next month. And then our next work group is Teens and Transitional Youth, Dawn, Marcia, John, Lisa Miller, Pastor Mize, Nicole, and Anthony. And I don't know if that's Anthony or John sharing out on that or somebody else.
I'll go ahead and share. We had a small group that was able to meet mid-September for our first meeting, just to brainstorm some potential goals and action plan for the section. We had Lisa, Pastor Mize, myself, but nothing was formalized because we want to obviously engage the larger group. So I'll be working with Dawn and Marcia, Lisa, Pastor Mize, Nicole, and Anthony to find that day that works for everybody. Tentatively targeting maybe the fourth Tuesday of each month in the afternoon. But some of the things we want to tackle at our next meeting for this section will be desired outcomes for the work group. So identifying the support needed for teens and transitional youth in the Milpitas community, prioritizing the primary focus areas of the support needed, leveraging resources and partnerships. Some examples are just the county resources at the school sites, county resources in the community, and then the resources that we're starting to build up with the Recreation Community Services website. And then the town halls, presentations, symposiums, et cetera, just starting to bolster that as it relates to youth and teens. And then lastly, we're going to talk about communication, messaging, and counseling opportunities. So we have the agenda set. I'll be working with the group offline to schedule that date. But Pastor Mize, Lisa, did you want to share anything from our first go at this a couple weeks ago?
I thought we had a lot of really good discussion, and I think there's a lot of really great ideas, and I'd love to, I'm really excited about this town hall idea, for example. I love to just set a date and get something going.
Lisa has her finger on the pulse of the youth here in Milpitas, and I appreciate all the ideas that she had and the great input she put, and looking forward to everyone else getting involved as well in that group.
And for everyone else, we'll get you caught up to speed, promise, when we start the next meeting. But we didn't want to formalize anything. Like I said, we want to get everyone's involvement. So we'll get that together in the next couple weeks.
Great, thank you. And our next item, other updates. I just want to let you all know that we have extended an offer and it's been accepted for our new social services coordinator position. And that person will start on October 26th. And so I'll bring her to our next meeting. Her name is Charu Agarwal. And she's got a lot of experience in case management and working with a variety of populations. And is real excited to get involved in our HOPE task force. Charu will be offering case management services to the community. This is something that we've done for seniors for quite some time, but we recognize that there's a need for case management, excuse me, for all folks in the community. And Charu is going to allow us to expand that service for low-income folks and folks who are non-native speakers and people who are unhoused, a variety of folks who could use some assistance connecting with resources in the community. So we're super excited about that. And that brings us to the last item. John, I have your name on it. Do you want to wrap it up?
Well, yeah, Tegan, did we want to, I don't know if we really covered any updates from the rest of the group. Did anyone at this time, did anyone want to share anything from their areas or?
Yeah, this is Matt Jacobs from Kaiser Permanente. Sorry, I came in a bit late. I mentioned I would be, but if anybody's having, it sounds like somebody's having some trouble getting through to some folks at Kaiser, please just contact me and I'll see what I can do to help. My email is matthew.l.jacobs@kp.org. Sounds like you're looking to get a couple folks to come speak, so I'll see what I can do to help.
Thank you.
I mean, I can't guarantee anything, but at least they get an internal email from me. So, no, but in all seriousness, please send me a note and who you're looking for, and I'll see what I can do to help.
Can you put your email in the chat?
I could. Let's see. I'm on my phone, so I've never tried to do
okay.
that via my phone, but I can sure try.
If not, maybe somebody can send it.
I can do that for you. Thank you. It's matthew.l.jacob@kp.org. Uh-oh. Is that right?
Jacob, Jacopv, right?
2 B's?
2 B's?
Is that what you said?
1 B?
I think it's 1 B.
Yeah, at
I don't
Kaiser?
know.
No,
At
KP.
kp.org?
Okay, thank you.
I think I'll send a roster, email a
think
roster
that's
around
it.
to everybody so we can update and
Oh,
get
that's right.
everybody's current info.
Oh, Jacobs with a S. Okay, sorry.
Anything else from the group? Vic, do you have any words of wisdom or anything to share?
If you can't find Matt's email, I've got it.
Oh.
Tonight's our NAMI general meeting, if anybody's interested. Ms. Williams, Don shaking her head. We had a good event on Saturday, right, Don?
Yeah. Yes, the NAMI walk. Yes.
So that's tonight. It's at 7 o'clock. If people want to, are interested, I can send you. She hasn't issued the Zoom link yet, but she will. So we have that. Out of the California Office of Education, they're planning a group of webinars. One will start later this month, but people might be interested in the December one. We haven't set the date yet. I'll moderate it, and Joyce Chu, who's out of Palo Alto University and does a lot of work with our county suicide prevention program, will present on Mental Health 101. And then in January, Shashank Joshi, who's also involved with our county suicide prevention program and is he's child psychiatrist out of Stanford University. He'll be talking on suicide postvention. I think that date is January 26th. He will be talking along with co-presenting with my wife, Mary Jack in. So those are some things coming up out of the California Office of Education.
Great.
And I think that's it. I've never seen Bob so quiet, by the way.
Bob, you want to respond to that?
Only that they can mute me from over there. That's why I'm so quiet.
I actually have some exciting news from Cassie, if it's okay to announce it.
Please,
So,
yeah.
great. So this is like fresh off the press that we're going to be providing some parent workshops, and I'll get the flyers out to you all. But basically, it's called Parenting and Supporting Our Youth During COVID-19. And it's focused on concrete strategies for how parents and caregivers can best support themselves along with their family. So they're going to get real concrete take-home suggestions on how to, deal with this ongoing pandemic and everything else that's piling on top of it. And we're going to be offering it on 2 dates via Zoom. Monday, October 26th at 6 o'clock and Friday, November 6th at 6 o'clock. And myself and another CASI therapist will be facilitating it. And so it's going to be super interactive and informative. We're hoping it's just going to be fun.
Great.
Great.
Thank you. Anybody else? All right. Well, thank you all for giving us some time this afternoon to share about the activities that are going on. Look forward to seeing you all in November, and I'm sure many of us will talk in the in-between time. So thank you.
Thank you.
Take care.
Have
Thanks,
a good
everybody.
night all.
Bye-bye.
Thank you.
Bye.
Nice meeting you guys.